In this podcast episode, Dr. Nathan Bryan, a leading expert in nitric oxide research, discusses the critical role of nitric oxide in preventing chronic diseases, particularly cardiovascular disease, which is the leading cause of death worldwide. Dr. Bryan explains that nitric oxide is essential for maintaining the normal structure and function of blood vessels, and its loss precedes the structural changes associated with cardiovascular disease by many years. This makes nitric oxide a key factor in the onset and progression of vascular disease. Dr. Bryan identifies 4 common hallmarks of disease: low blood flow, inflammation, oxidative stress, and immune dysfunction. Nitric oxide addresses all these hallmarks by improving blood flow, reducing inflammation, preventing oxidative stress, and maintaining immune function. By restoring the body's ability to produce nitric oxide, it is possible to mitigate the onset and progression of chronic diseases. The discussion then shifts to the connection between nitric oxide and Alzheimer's disease. Dr. Bryan highlights the impact of proton pump inhibitors, PPIs, commonly prescribed for acid reflux, on the risk of developing Alzheimer's. These drugs inhibit stomach acid production, which is essential for nitric oxide production. He recommends weaning off PPIs gradually and supplementing with nutrients like zinc, iodine, and B vitamins to support stomach acid production. The disruption of nitric oxide production leads to reduced blood flow to the brain and the formation of misfolded proteins associated with Alzheimer's. Dr. Bryan emphasizes the importance of lifestyle factors in maintaining optimal nitric oxide levels and overall health. Excessive sugar consumption is highlighted as a significant factor that can lead to glycation, insulin resistance, and chronic inflammation, all of which contribute to the development of chronic diseases like diabetes and Alzheimer's. Monitoring markers such as fasting glucose, hemoglobin A1C, triglycerides, and fasting insulin can provide insights into metabolic health and the risk of developing these conditions. Dr. Bryan also discusses the impact of being overweight or obese on nitric oxide production and overall health. He notes that even individuals with a normal BMI can be metabolically unhealthy if they have excess body fat and low muscle mass. Maintaining a balanced diet, incorporating protein, and avoiding excessive carbohydrate consumption, especially late at night, can help support metabolic health and nitric oxide production. Nitric oxide is a gas produced in the lining of blood vessels and plays a vital role in vasodilation, neurotransmission, immune response, and gene regulation. Its discovery led to a paradigm shift in signal transduction, as it can diffuse through cell membranes and activate signaling pathways without the need for specific receptors. Nitric oxide binds to metals, activates hemoproteins, and post-translationally modifies proteins to regulate various cellular functions. As people age, there is a natural decline in nitric oxide production, but lifestyle factors can accelerate this decline. One of the key factors affecting nitric oxide production is diet. Excess sugar consumption and a diet high in ultra-processed foods can hinder the body's ability to produce nitric oxide. Additionally, modern farming practices have led to a depletion of essential micronutrients in the food supply, further impacting nitric oxide levels. Dr. Bryan emphasizes the importance of consuming a diet rich in nitrate-containing foods like leafy greens and beets, as these can be converted into nitric oxide in the body. A sedentary lifestyle is another significant contributor to decreased nitric oxide production. Regular physical exercise is essential for stimulating and activating nitric oxide production in the body. Lack of movement and physical activity can lead to a host of health issues, including reduced nitric oxide levels. Dr. Bryan also highlights the impact of daily habits on nitric oxide production. The use of mouthwash, antibiotics, antiseptics, and fluoride-containing products can disrupt the oral microbiome, which plays a crucial role in nitric oxide production. These products can kill beneficial bacteria responsible for producing nitric oxide, leading to a decrease in overall levels. Sunlight exposure is another factor that can influence nitric oxide production. Certain wavelengths of light, particularly in the UV and far-infrared spectrum, can stimulate the release of nitric oxide from proteins and metals in the body. Sunlight exposure can help optimize nitric oxide levels and improve overall health. High blood pressure is closely linked to nitric oxide levels in the body. Nitric oxide helps dilate blood vessels, allowing for better blood flow and lower blood pressure. When nitric oxide production is compromised, blood vessels can become constricted, leading to increased pressure and potential health issues. Dr. Bryan discusses the role of oral bacteria in nitric oxide production and its impact on blood pressure. He explains how certain oral bacteria are responsible for vasodilation in systemic blood vessels, which helps regulate blood pressure. Disruption of the oral microbiome, often caused by the use of mouthwash and fluoride-containing products, can lead to hypertension and other cardiovascular issues. Dr. Bryan found that stopping the use of mouthwash and fluoride-containing products can lead to a rapid normalization of blood pressure. By allowing the oral microbiome to repopulate and restore nitric oxide production, individuals can see significant improvements in their blood pressure levels. To protect the oral microbiome and support nitric oxide production, Dr. Bryan recommends avoiding fluoride-containing products, using high-quality water filtration systems, and incorporating regular physical exercise into daily routines. By making simple lifestyle changes, individuals can optimize their nitric oxide levels and improve their overall health and longevity. When it comes to testing nitric oxide levels, Dr. Bryan discusses the limitations of nitric oxide test strips that measure salivary nitrate. He explains that these strips can sometimes give false positives, as they may detect local immune responses from oral infections rather than systemic nitric oxide production. Instead, he suggests that individuals focus on symptoms like erectile dysfunction, high blood pressure, metabolic disease, and exercise intolerance as indicators of low nitric oxide levels. Dr. Bryan also mentions the EndoPAT test, a functional test that measures endothelial function and can serve as a proxy for nitric oxide production. He explains that functional tests like the EndoPAT test provide valuable insights into how well the blood vessels are dilating and functioning, which can be indicative of nitric oxide levels in the body. Dr. Bryan also discusses the role of supplements in enhancing nitric oxide levels, explaining that while supplements can provide a boost in nitric oxide, they should be viewed as an insurance policy on top of a foundation of healthy lifestyle habits. Dr. Bryan touches on the potential for pharmaceutical interventions targeting nitric oxide production. He mentions ongoing drug development efforts in his company, Bryan Therapeutics, aimed at creating drugs for conditions like ischemic heart disease and Alzheimer's. He emphasizes the importance of restoring nitric oxide levels through targeted interventions that focus on recoupling the nitric oxide synthase enzyme rather than simply inhibiting biochemical reactions. In summary, Dr. Nathan Bryan's discussion underscores the critical importance of nitric oxide in maintaining vascular health and preventing chronic diseases. He highlights the impact of lifestyle factors, diet, oral health, and modern medications on nitric oxide production. By making informed lifestyle choices and addressing factors that impair nitric oxide production, individuals can significantly improve their overall health and longevity.